First, I'm going to talk just describing what the Align-RT solution is for closed-bore LINACs, and then talk about two use cases that we use the system for in our clinic. The first being DIBH treatments for breast radiotherapy, and then the second are adaptive radiation therapy on treatment monitoring. Okay. So what are the special considerations when you have a closed-bore LINAC? Specifically, we're talking about the Halcyon and Ethos LINACs. They're very streamlined. We love these machines because they're so efficient and we can just crank patients through, giving them high-quality treatments but very quickly. And then also the Ethos has the adaptive capabilities. But they're a little different than your standard LINAC. They have no light field, no ODI, no portal imaging, and you have to do SGRT for every patient. So you can probably think about treating breast patients how this might present some unique challenges. And you set up at the external lasers that are outside of the bore, and then you, with one button push, you slide them into the treatment ISO, and you image and treat from there. And then finally, the next thing to know is that it's just a 3 degree of freedom couch, so you can't correct for any rotations with the couch. So the Align-RT in-bore system helps to overcome some of the challenges. It's really two systems. So there's the standard ceiling-mounted cameras that you all know and love from Align-RT, and those help you with your initial efficient patient setups. And then the SGRT ring camera system is the in-bore part where it's mounted inside the bore. It's very just low profile, so it's actually kind of hard to see in the picture. I can kind of flick back and forth, trying to highlight it there. And that's how they monitor inside the bore. So kind of giving you that view you wouldn't have with the ceiling-mounted cameras. Okay, so first we started using this for DIBH breast because otherwise we had no way to treat these patients and we weren't putting them on our Halcyon. So here's just a picture of what it looks like with a Phantom. Right now the Phantom is sitting inside the bore. And then we're using the Align-RT system in the treatment mode. So that's when you're switching to using the in-bore cameras. And you can see the interface looks just like the one for a normal ceiling-mounted system. So it was easy for our therapists to pick up. They knew exactly what to do with it. And they were just switching between the setup mode, which is the ceiling-mounted cameras, and then the treatment mode for the in-bore cameras. So our workflow for treating breast patients is we first set them up in setup mode using those ceiling-mounted cameras at what they call the virtual ISO center, so the lasers in front of the bore. And then we use Align-RT to correct any rotational errors so that they're in the perfect position before we're sending them in. And then with that one button push, we slide them into the treatment ISO center, and we switch the Align-RT system to the treatment mode, which uses the in-bore cameras. And from there, we can just use it for intrafraction monitoring, or in our case, if we're doing DIBH, we'll use it for DIBH. And it's an extremely efficient, nice workflow. Our therapists and doctors all love it. So we did a little bit of a study for our first now 21 patients we've treated on it. We wanted to look at how much residual error there was after we set up with Align-RT, and we're cone beaming all the patients because remember, Halcyon and Ethos, you have to do some kind of imaging. And so we're using their very low dose, but still high quality cone beam CT. And we found that the shifts were very minimal. And more importantly, we were rarely needing to repeat the cone beam CT to correct for any rotational errors that we couldn't correct with couch translations. And coming from where we were doing weekly MV imaging for these patients and now doing daily cone beam, we were highly motivated to not have to give any more dose than we needed, ALARA, right? And so we needed to do repeat cone beams in less than 4% of all fractions. And for 20 of the 21 patients we first treated, we had to do at most one for their whole treatment course. There was always that one trouble patient, you guys all know that one, that just never quite sets up right. And she ended up needing repeat cone beams for about half the fractions. But other than that, there's other groups using Halcyon that have reported their numbers of cone beam CT, and this is actually much smaller. And so that's because we've been using Align-RT. It also, as we all know, it makes for a very efficient workflow. And so our average time from the start of the cone beam CT to beam off for all patients was about a little over 3 minutes and generally less than 5 minutes. And our DIBH patients have all been on the faster end even. So we're treating them in under 3 minutes from that cone beam to the last beam off. The cone beam itself is very fast, so it can be done in one breath hold. And that helps us have 10-minute appointment treatment appointment slots, except for the first fraction where you have to wait for the doctor to come look at the images. But actually, because it's so efficient and easy, this is now our standard way to treat any DIBH patients that need a cone beam, so our mediastinum, our stomach. We don't want to have to go back to using our other system. It's nice. Okay, so moving on to the adaptive on-treatment monitoring. We got our Ethos last summer, and this is what it looks like, very similar to a Halcyon. It just has that extra functionality to do the online adaptive treatments. And then, sorry, let me go back. And you can see there, again, the very low profile in-bore ring hiding inside there. And we've done, I think we're on our 20th patient now, actually. A bunch of different types of sites, but we've really just been focusing on the pelvis anatomy. And we've looked at how long these patients are actually laying on the table while we're doing this, from the start of the cone beam till we're done treating them. And you can break them up into two cohorts that I personally think is directly proportional to how much bowel you have to contour in the adaptive workflow. So those more complex ones, we're taking about 30 minutes for the patients. That's a really long time for someone to have to lay there and be still, and we're just hoping they are still in the same position as when we took the cone beam. So you can imagine why we'd want to do intrafraction monitoring. And that is what we're doing. And so you can see here the same patient where she was staying nice and still for this whole treatment, and then she ended up kind of shifting and getting off. And so if this happens early in the adaptive workflow, we can just kind of restart from the beginning and retake the cone beam and move on. Or if it's later in the workflow, we'll do a verification cone beam at the end and make sure that the shifts make sense with what we saw on the Align RT system. And then we feel confident that when we did all this work to make a new plan of that day, that we are actually delivering it. So in summary, we've used Align RT to overcome the unique challenges of treating patients with breast cancer on our Halcyon. And the most important thing there, I think, is minimizing unnecessary cone beam CTs. We're also using the in-bore system to facilitate doing DIBH. And then finally, the in-bore system has also allowed us to do intrafraction monitoring for those online adaptive radiotherapy patients. And we're actually also using it for SGRT as well.